Hey everyone, this is Dr. Dane with your Into Health video tip of the week. These are 2-minute videos designed to improve the quality of your health, thereby improving the quality of your life. And today we're going to talk about a common shoulder problem that I see in my practice often, and that's called shoulder impingement, right? Or shoulder entrapment. And in your shoulder, you have what you probably have heard of as the rotator cuff. The rotator cuff consists of 4 muscles that attach in and through the shoulder. One of the things that we see as people get older, their shoulder starts to round forward. So that shoulder starts to pull in and forward. And as it does, there's a lip of cartilage around the socket of your shoulder called your labrum. And that bone will start to impinge on the labrum. And as you move, especially if you hear clicking or cracking noises when you elevate your arm or lift it up, that's generally the humerus, the head of the humerus banging into the glenoid labrum. And over time, just from that friction, it can cause that labrum to degenerate and also to tear. The other thing is you have a muscle in the back of the shoulder here. It's an external rotator. It does this motion. And what that muscle is called the supraspinatus. It's the most common tear that we see of the 4 muscle groups. The supraspinatus is the most common tear. And as the shoulder rolls forward, it pulls the tendon into the bone. So again, as you move that tendon is kind of grinding into the bone, and that tendon over time can become weak, and then you can have an injury that tears it, or it can just wear, just like friction, just the fraying over time can cause the tendon to partially tear or fully tear, and it's very painful. People have a hard time elevating their arm out this way. So if you have a hard time lifting your arm out, especially if there's any weight in it, and you get pain, that's probably your supraspinatus. So these are common injuries we see in the shoulder. They all relate to distortion or postural issues in the shoulder. That's why we in our office not only start to work on the alignment of the shoulder and the neck, but we also start to focus on strengthening the rotator cuff and all the muscles through the scapula. So this is Dr. Dane with your Into Health video tip of the week. If you have shoulder pain or shoulder problems, please come see us, come look us up. Let's take a look at what's going on with your posture and the mechanics of your shoulder, and we will talk to you next week.